Hello, my name is Robert Brandon Sandor. I want to thank you for watching this video. Um, what is the purpose of this video? It's very basic and very simple. I'm explaining in greater detail the research that just recently came out from Seattle, Washington based on serosorting. And it was brought to the attention of the C.R.O.I. 2014 gathering in Boston here in the United States. And the reason why I'm bringing this to your attention is because back in the mid-1990s, I pioneered the concept of having sex with your own HIV status, not only for HIV negative gay men, but also for HIV positive gay men. And this research study is significant because it really is the first research in more than a decade that actually comes close to what I created back in the mid-1990s. A few of the highlights here. It says that only having sex of the same status partners is an HIV prevention strategy for 40% of gay men. Now, the reason why this is significant is that it's saying flat out in the research that 40% of gay men are deliberately choosing to have sex with their own HIV status, whether it be positive for positive or negative for negative. And the reason why this is significant, this headline is significant, is because it confirms behavioral change. This is behavioral change. This is something that the community is doing on their own without the intervention of the HIV agencies, organizations, experts, or professionals. The research study states this, okay? If you go to the research study and you read the report over and over and over again, you're going to notice one vital factor missing from this report, and that's any intervention of an HIV agency, organization, expert, or professional. Therefore, the headline itself is significant. Only having sex with the same status partners is an HIV prevention strategy for 40% of gay men. Now, this came out of Seattle. I would like to see this research concept go international, which means that if you're an HIV researcher watching this video, start writing your research for your municipality. If you're in New York, Boston, Miami, Chicago, Los Angeles, San Francisco, Denver, Paris, Rome, Madrid, Sydney, Australia, anywhere on the planet, start writing your research for this study based on the headline here that only having sex with the same status partners is an HIV prevention strategy for 40% of gay men. What is the percentage in your city? Then it goes on to say in the research study, that, and I'm saying here, and I quote, the Seattle study was designed to find out whether the sexual risk behavior patterns men disclosed in a typical behavior survey were purposeful. That is significant because it confirms a willingness to exercise your rights to freedom of choice and having sex with the same HIV status. Now, this is a freedom of choice issue, which means that there's nobody in the country, on the planet, that can say, no, if you're HIV negative, you cannot disclose your HIV negative status in public. You cannot have sex with your own HIV status. This is by choice, exercising a legal freedom of choice between an individual and their potential sex partners. So this is a behavioral change on the will of the people, the population, which is community driven. As I mentioned earlier, no intervention by any expert or professional. It also goes on and it says that They asked about the HIV clinic, asked sales users, separate their actual recent risk, sexual risk behavior, condom use, status of partners, sexual, and so on. And then asking them what sexual risk strategies they tried purposefully to use, which again, in this study, a scientific research study based on behavioral change. Now, automatically, more researchers should be jumping in on this. Psychology, sociology, economics. How is this affecting a person's self-esteem, their motivation to stop HIV, their desire to stop HIV? These are all psychological factors, social factors that the researchers in psychology and sociology need to be involved with now because it says so. The research is out there for you. It goes out to say, and this is significant here also, that out of 1,902 eligible men, 87%, which is 835, were HIV negative. That means that they tested HIV negative and they participated in this study, which means 87%. That's a significant number because never before in the history of the serosorting research has anyone went to HIV negative gay men, especially for those who use condoms. And it goes on to say whether about using condoms and not. This is a deliberate strategy. It says here that out of the HIV negative men, 42% were strict serosorters, meaning that they only reported having sex with or without condoms with other HIV negative gay men. Now this is significant because it says reportedly only having sex with or without condoms. Now here is a significant opportunity for the researchers to conduct safe sex serosorting research. Safe sex serosorting is when HIV negative gay men have safe sex condoms, using condoms. And this is what a condom looks like. Okay, for those of you who don't know what a condom looks like, safe sex serosorting, which means you pick up one of these and you use it, okay, during sex. Now this would be considered safe sex serosorting when you use one of these during sex, okay? For HIV negative gay men who use this, okay, during sex, that's called safe sex. This is called safe sex serosorting, when you have safe sex with your own HIV status. The research says right here, it's a published report. They also say that 39% reported this was a deliberate strategy, meaning this was deliberate. They sought this out. So why is this report so significant? Because on so many levels, it could be taken to a higher standard. First of all, we all know for a fact that it's been published. HIV negative gay men have been having safe sex in a major metropolitan city here in the city of New York back in the mid-1990s with other HIV negative people. And because of the use of the internet, this went viral. What other supporting evidence do I have? I like to Out magazine. This is from April 2002. Contact the publishers of Out magazine. Contact Steve Weinstein for his article here on positive thinking. Here in the article, and it states, and I read, quote, that certainly many HIV negative men remain concerned enough about their health to enhance their encounters with other HIV negative men. Just check out the code words in AOL profiles: safe only, healthy, disease-free, HIV negative, UB2, and so on. It says so right there. Look, it says so right there. Okay, so this has been going on since the mid-1990s. It's brought to the national stage from Out Magazine, Steve Weinstein in 2002. And the Seattle researchers are just now picking it up. The researchers. So therefore you have a wealth of information out there. Now, another article here in HIV Plus magazine, and this was from July 2006. Okay? In July of 2006, right here, letters to the editor, okay, letters to the editor, I state right here, empower all, and I state, however, it is very important to inform the HIV negative population of a vital fact. Serosorting can be applied to them as well. When HIV negative people have safe sex with other HIV negative people, no HIV negative person gets infected with HIV. It's a physical impossibility. Why? Because we physically break the cycle of new HIV transmissions. Okay? So it's been published. So now, finally, in conclusion, what is the significance also of this research study? Not only are the HIV agencies and organizations not mentioned, therefore they have nothing to do with the future of HIV prevention. How is the population communicating with each other? That's another research opportunity for you across the board. Communication. How are HIV negative gay men communicating with other HIV negative gay men, their HIV negative status, and their desire, their willingness to have safe sex with other HIV negative gay men? More importantly, how are HIV positive gay men communicating with each other about their HIV positive status and their desire to have sex with their own HIV status? Case in point, right here. I'm HIV positive for HIV positive, which means I'm only having sex with other HIV positive gay men, which means I'm physically breaking the cycle of new HIV transmissions. Also, another alarming highlight of this study is that this is supporting evidence of a unification, unity within the HIV positive community and the HIV negative community to physically break the cycle of new HIV transmissions and to stop the spread of HIV dead in its tracks now. We're not relying on medications. We're not relying on any magical pills or PrEP or vaccines or anything. What we're doing is we're doing this on our own because we are fed up. And we've been doing this for years. And it's now time for the HIV agencies and organizations to step aside. We've lost confidence in them. It's time for the HIV researchers to step up to the plate, to take their role in HIV prevention seriously, and to provide us with the necessary research so we can move forward. And the research across the board, from economics, sociology, psychology, communication, across the board, self-esteem, everything. And how does economics play into this? Economics has a big factor because now we don't need to fund HIV agencies or organizations because they're not supporting us. I wrote the book, Central Sex Venue Etiquette and Research Guide for America's Gay and Bisexual Young Men. Why is it important? Because this book breaks down how it's done. This book was published in 2013, and we discuss motivation, desire. There's a glossary in the back to give you all of the resources, the definitions of safe-sex serosorting, serosorting, it's D&D free. This is the first book of its kind written for the HIV negative community. My name is Robert Brandon Sandor. Thank you for your attention of this video. I'm looking forward to reading future research on this topic, on my pioneering work from the 1990s, and seeing how the idea is evolving. Feel free to contact me if you have any questions, comments, or concerns. If you're here in New York City and you want to discuss this even further, here's a thought: a public forum. Let's get GMHC, the Health Department of the City of New York, and the Health Department of the State of New York, and me, on a panel discussion in front of a live audience with the media present. And we'll discuss this in detail. Thank you.